Breast cancer is increasing, especially in younger age groups of 30s and 40s. What are the reasons for this? In spite of breast removal, radiation therapy, chemotherapy, targeted therapy, immunotherapy, etc., recurrence of cancer happens in many cases. Even when modern medicine and science has progressed to such a great extent, why does cancer suffering and premature deaths continue to increase? Cancers are lifestyle-related diseases. Unfortunately, in cancer treatment, lifestyle correction is not given importance. This is why recurrence of cancer is common. Only when the shortcomings in the lifestyle are identified and avoided can cancer and recurrence be prevented. We can have a look at how treatment that focuses on identifying and correcting lifestyle-related issues benefits patients who were at different stages of breast cancer. Health tips are not the focus here. Rather, the effort is on providing information that will help you to understand the causative factors behind this disease, measures for early detection, investigation to assess the impact of disease on different parts of the body, available treatment options in modern medicine with their benefits and limitations. The goal is to help you understand the relationship between the disease and the lifestyle factors. More importantly, to understand the impact of lifestyle correction on reversing the disease process and preventing recurrence. Those who are on medication should remember to reduce or stop medicines only under medical supervision. To get a better understanding about the breast cancer, we should have a bare idea about how the breast anatomy and its development, etc. So, breast is basically start to develop by the 7th week of intrauterine pregnancy itself. That is when the embryonic stage itself, breast development happens. It is actually developing in an appendage of the skin, as a part of the skin. It's a modified or highly specialized set or sebaceous glands, we can say. And at birth, male and female breast is basically the same. The changes happens during the puberty, that is at the teenage growth time, when the first estrogen, the feminine hormones start acting, and the growth hormone when it is acting, and the breasts are developing. And next phase of development happens during pregnancy. Then there is estrogen and progesterone is promoting, and also prolactin hormone or third hormone also is coming in. And next is lactation. During lactation time, there are prolactin hormone and the oxytocin hormone is there. That is, oxytocin is basically the other hormones from the placenta, and this prolactin also mainly from the placenta during the pregnancy, and after pregnancy, prolactin and the oxytocin is come from the pituitary that is connected to the brain, and it has a major role in developing the affection and love towards the child also. Next, when we come to the cancer, what is the reason for the cancer? Basically, the reason is the mutation or the DNA damage which is happening in the somatic cells, that is the cells of the breast. Usually, it is a duct, the alveoli is the duct, that the part is which is transporting the milk. Usually, we see the ductal carcinoma, and there are different types of cancers of the breast. And basically, because of the toxins exposure or the nutritional imbalance, this DNA damage take place, and the DNA damage, when it is accumulated and so many mutations happens, then it is the division capacity, the control of division of the cells will be lost, and the cells will start to multiply without any order. So that is the mechanism in all sort of cancers. Actually, this particular cancer, when it comes in the breast, the part of the breast is affected in that way. Next, when we come to what is the reason for this mutation happens, first, as we said, there is nutritional imbalance and toxins, and also another important factor which is playing here, the hormones. Even in the male, usually after puberty, there can be gynecomastia. There is male breast is growing like female breast. That is called gynecomastia, and usually it is treated by removing the breast. It's a surgical removal of the male breast is done in that. The surgical removal of female breast is done for the cancer, but it's a male breast for this gynecomastia. Actually, it is a hormonal problem. See, when there is obesity, usually this gynecomastia happens with the obese men. And that is because there is excess fat in the body. From the fat, the estrogen is developed. And also in the obese men, usually the testosterone level will go down also. The estrogen, feminine hormone will increase and the testosterone level will go down. And that is the reason for the gynecomastia. And it should be ideally treated by weight reduction and correcting the lifestyle factors. And also there is some estrogenic things can come out from this plastic, and also the pollution also is doing a major part in that. So expelling the toxin and to correcting the nutrition is the answer for that. But here now we do it is a simple way, do the surgery and remove it. That is actually not correct, because even though it is breastfeeding is not necessary done by the men, it is actually many plays, it has an important role in the sexual, emotional aspect of sex and also it is a connection to the brain. Next is another major problem is in the cancer and also in the gynecomastia also. The fat, the one is lean mass fat mass ratio. That is actually the body composition, it matters for everything, every aspect of. Actually we are thinking that the brain is controlling. Actually the fat is controlling the brain. Brain also made of fat mainly. And next is the omega-3-6 balance. The fat itself is having the essential fatty acids omega-3 and omega-6 is controlling the inflammation and anti-inflammation. That is the defense and healing aspect of the body. And so if the omega-3-6 balance is omega-6 is high in the stored fat and also in our food, the chance of getting cancer will be high. Next is the symptom. What are the symptoms and signs of breast cancer? One is lump, that is a small growth or tumor which is identified, but all the tumors may not be cancer at all. And the nipple changes, the inversion of the nipple or nipple dimpling, or the skin change in the color of the skin, or the shape or the size of the breast is increasing. Those are the changes usually felt. And also the discharge. Usually there will not be for during pregnancy only, but there can be a white clear discharge can be there also, otherwise also. But if the milky discharge is there, we should consider it's a hormonal imbalance, especially prolactinoma or prolactin, high prolactin levels. But if the bloody discharge, blood or black discoloration is seen, then that also should be taken as seriously. Next, how to finalize how to come to a diagnosis. The early detection is by self-check. That is the most important. The women should check their breast in the reproductive age after menses. That is especially in the 5th, 6th or 7th day of the periods. Then if it is postmenopausal, every month beginning, first of the day, or we can fix a date accordingly, each one's convenience. And first, second or third can fix and check it every day. If you are regularly examining, if there is a small change happens, you will be knowing it. And inspection in the mirror and also palpation, and the breast and the axilla also should be palpated for any lumps, small lymph nodes also can be grown in or even there is a axillary tail of the breast, in that also changes can happen. Next, if you suspect, definitely you should visit a clinician, usually a gynecologist, or it depends on the country. In our part of the country, usually ladies will go to a gynecologist and see what is the problem. And then generally the mammography is one of the tests which is taken for the early detection actually. But the problem with the mammography is there is exposure of X-ray radiation is there. So multiple previously every 2 years mammography and all was done. But nowadays because after so many years of experience, it is actually the important or the interest is coming down on that because of this exposure. Actually, we all know that X-ray can be carcinogenic, and we are a very delicate part, and we are continuously exposing every 2 years. It is actually not logically or scientifically in a way not acceptable for an early detection also. So for the early detection, it is always better do the self-palpation, and if you diabetes tracing, ultrasound scan. Nowadays very sensitive ultrasound scans are available, and you can look into the ultrasound scan. If there is that in the ultrasound scan also there can be changes if the swelling can be detected, and also the calcification sort of changes if it is chance of cancer will be high. And next is an FNAC, that is fine needle aspiration biopsy, which can be, the cells can be withdrawn from the tumor and histopathological examination, and we can see whether the cancer cells is there. And next, if there is a strong suspicion, or if the FNAC shows that there is a cancer, then definitely we can go into a PET scan. So we will be able to know the staging, whether it is only stage 2 lymph node development, or stage size also 1 to 4 for the according to the tumor size, and 0 to 3 according to the nodal size, and then metastasis, distant metastasis also. That is the staging, and that is for the PET scan is ideal for that. But if the FNAC shows there is not any cancer, or there is only suspicious cancer, or there is no problem also, we can remove the excision biopsy can be done, and proper histopathological examination can be done, and clear diagnosis will be there. And also, if there is a lymph nodes, enlarged lymph nodes are there, that also can be biopsied. But if you are going for a PET scan, that will give all the diagnosis actually. And finally, after the this biopsy also, you have to go for a PET scan for the staging of the cancer, to see whether there is any whether it is third stage or fourth stage. Third stage means it is locally spread, especially into the chest wall. If the growth has gone deep into the chest wall, it is next stage. And if it is going to the liver or lungs or brain or something, then it is distant metastasis, that is stage 4. Then next is actually what are the studies which is done with that is histopathological examination with this excised tumor, and that can be grading can be done, and also the receptor study, and also this estrogen progesterone, which that is mainly for understanding which medication will be better for the treatment. Hers to another type of receptor, because that is all for the doctor's point of view, to oncologist's point of view, to decide on which medication, which cancer medicine has to be given. Then when we come to the predisposing factors of the cancer, the genetics and the lifestyle, both are, it's all lifestyle diseases, and basically there is in almost all the diseases there are 2 factors are there. One is genetics, and the next is lifestyle factors. In BRCA1 and 2 mutations, the genetic study, actually, if the familially, if the breast cancer possibility is there, if the mother is having breast cancer, the children, doctors maybe want to know it, then we can definitely look into BRCA1 and 2. But it is not 1 or 2 genes actually controlling. So if your BRCA1 and 2 is negative, doesn't mean that you won't get the cancer at all. But the only thing, if it is there, you can be more careful, and if it is not there also, you should be careful. Then the other factors which is predisposing in the lifestyle factors is first is obesity, because breast is actually basically a fatty tissue, and the fat, especially the omegas, obesity, the fat content in the body is increasing, and the omega-6 fat content, and also the trans fat and saturated fat, especially this hydrogenated fat, this all will increase the possibility of the cancer. And also the other lifestyle factors like alcohol, smoking, use of perfumes and hair dye, repeated use of hair dye, and this hair straightening. So many treatments are done on the hair nowadays. No, we think that it is only this hair is affected. Basically, this hair follicle, the root of the hair is very much getting circulation and is very fast growing, and so it will spread even if you are applying the things only on the hair, but it can spread into the whole body. And it is proved that there is the hair dye and this hair treatment, the straightening and curling and such things can, the chemicals used in that is increasing the chance of breast cancer and uterine cancers and ovarian cancers also. Next is pregnancy and breastfeeding. Actually, pregnancy and breastfeeding has a positive impact, that is, it will reduce the chance of breast cancer, especially if you have at least 3 years of breastfeeding time, then it is definitely your chance of getting breast cancer will be less. So if you are planning for only one child, or can breastfeed the child for longer time. So all the ladies should think of, younger ladies should think of breastfeeding the child at least for 3 years. If only single child, breastfeed for 3 years. And if more, definitely more years of breastfeeding will protect your breast. Next is infertility treatment and PCOS, the polycystic ovarian syndrome. That there will be so many other hormonal changes in PCOS patients. The estrogen level will be high, so and the progesterone will be low, and that imbalance in the estrogen and progesterone hormone itself can increase the chance of breast cancer. And also the infertility treatment. Infertility treatment means there is a fertility problem, and it's all hormone. Infertility is a hormonal problem basically. So there is an imbalance. So such patients, such ladies will be having a high chance. So they should be more careful about breast cancer. Next is endocrine modulators like a plastic, the use and the DDT, then as pesticide, DDT, plastic, etc. can increase the chance of, especially when we are using the bottled water and all, we should be think of this problem. It's because when you are taking the hot food in a plastic vessel, some toxins, some chemical will come into the mingle with the food, including the water bottles. So we should reduce the use of plastic, especially as food containers, especially when you are using hot food in a plastic, because now Swiggy and all this food transporting is so common. No? So you are getting everything in the plastic. Most of the things are in the plastic. Even in the foil pack also, it is causing another sort of problems. Anyway, we had to bear all these things and try to reduce anyway the use of hot food, at least in the plastic vessels. Next, when we come to the treatment of the cancer, it is this first thing usually is either a lumpectomy, that part of the tumor is removed, the tumor is fully removed, or the breast is removed, or if the doctors are feeling more spread and anything, then the radical mastectomy. Radical mastectomy means either the lump is removed, lumpectomy, then is mastectomy, then is radical mastectomy, that in that the breast and the associated lymphatic system also is removed. And usually after that there will be chemotherapy and radiation therapy, or radiation therapy then chemotherapy. It depends on the tumor nature and all, the doctors will be deciding on that. Chemotherapy is also, there are so many type of medications are available, methotrexate, fluorouracil, and paclitaxel, and so many names also. It is very confusing, so I am not going into the details of the names of the chemotherapeutic agent. Each will be having different type of side effects. Some will be having giving the hair fall. This many of the medication will completely, the hair will be grown, and so many. Some are cardiac toxic, some are neurotoxic, bone marrow toxic. So many, because it's all destructive. That is actually all are reducing the division of the cells. So the most fast dividing cells are the hair follicles and the lining of the intestine, lungs, etc. So all this part can be affected, and also the nerve system covering. That also immunological cells which is covering the nerves and neurons. That is glial cells and all, it will be the division of that also will be affected. That is the reason for the neurotoxicity. Of course, the liver and kidney toxicity also will be there. Next is the immunotherapy. Immunotherapy, it is the biologicals actually. So that is actually not directly in the bone marrow or the immune system, but the immune system agents which is responding to the immunological response actually. So different types are there that blocking at different levels. So if it is HER2 receptor positive patients can be translucemab. That is, so most of this called the end of it will be MAB, that is monoclonal antibodies. So they also have the toxicities, are some are cardiac toxic, and every month or every 2 or 3 months new biologicals are coming. The thing is, we don't know what are the benefits and what are the side effects, and even the newer medicines will be very costly also. But if you take these medicines also, the patients is getting recurrence and the problems are coming. So we can't, all of them are actually destroying or blocking the immune system in multiple ways. So everything will be having side effects also. Some will be having more, and we don't know really what is the benefits also. Next is hormone therapy, because the breast is a hormone dependent organ. It is hormones like tamoxifen, letrozole and GnRH agonist injections. So one is the other two are tablets and injection. And next is oophorectomy, that is the ovary, removal of the ovary. These are the different types of treatment. But this tamoxifen and letrozole and agonist also actually blocking the hormones. That also will have many of the side effects also. So we do all this surgery, radiation, and this everything is done, but again the recurrence chance is continuing like that. Then what is the real solution? What is the reason for this? We are doing all the surgeries, removing the breast and removing the immune system, radiation, chemotherapy, multiple doses, then biologicals, everything we have tried also. There are people who are getting the cancer again. What is the reason? Basically, we should understand that it is let's say cancer is breast cancer and all the other cancers are a lifestyle disease. The lifestyle factors is the most important aspect. But no one is giving any importance for the lifestyle. To find out what is the problem, why everyone will ask why I got this. But no one is trying to find out the reason behind and to correct it. So basically, it's a lifestyle disease, and find out the reason behind that. Either toxins in the body, even the excess fat in the body in the form of obesity is a reason. So, and also the color preservatives in the food, and even this plastic intake in the form of unknown plastic intakes in the hot food in the plastic vessels, everything is contributing to it. And also this the essential fat, there are the new essential nutrients imbalance. If there is a imbalance in the nutrition also, it will affect the repair of always there will be DNA damages coming up, but if the repair is needed, you have to give optimal nutrition. There will be nutritional deficiency will be there, and toxins will be excess. That is the reason. So correct it. Even if you are if you are not correcting the lifestyle factors, the reason for the recurrence is basically not correcting the lifestyle factors. If you are correcting the lifestyle factors, then the chance of recurrence will be reduced definitely. If anyone is diagnosed with a cancer, immediate focus will be on removing the cancer and chemotherapy and radiation, especially in case of the breast. So, if in some cases, even in the 4th stage also, we just go for this, whatever we can do it, that will be the attitude. Most of the cases, when they are diagnosed with the cancer, the patient will not be having only that breast swelling will be there. But patient will not be much symptomatic, or patient will not be having even discomfort. But we are thinking that it will grow fast and you will get into trouble, you will go for the surgery. But there is no study about what will happen if it is not done anything actually. So I'll give an example of a patient who has gone for a lifestyle correction after diagnosing with cancer. So she's a 72-year-old lady, 151 centimeters height and 65.4 kg is the weight. And she is taking medication for diabetes, hypertension and dyslipidemia. that is for the cholesterol for the last 15 years. And also she is having a tumor, small benign tumor of parotid, left parotid gland also. One swelling is there. That is also for the 16 years. She had done a biopsy and all before itself, but it's a benign tumor and she didn't bother to remove it. And she is, for the last 1 month, she noticed a breast swelling, and he had gone to the doctor, and biopsy has, mammography and biopsy has done. It is proved that there is breast cancer. And there is lymph node involvement also is there. Multiple lymph nodes are there in the axilla. So she was advised to go for a radical mastectomy, radiation and chemotherapy. And she actually worked in cardiac unit before, and palliative care, and all, she was exposed to that. So because she had seen many patients who had undergone surgery, and the pain and the discomfort and the recurrence and the cost of treatment which she is putting on their family, and considering multiple factors, she decided that she was not going for the chemotherapy, surgery, etc. And instead she asked for this lifestyle correction. And what I am giving is clinically supported. It's not just giving an advice and this and this. Not, it's actually studying the patient properly and then correcting their food habits and exercises and everything is in a systematic way. So she's a diabetic patient also. In cancer patients, reversing the diabetes is the most important thing, because most of the diabetic patient will be having very high insulin levels. She's also having an insulin level is high. So there's no need for medication. Almost all the medications are increasing the insulin level actually. So it is not only the glucose is harming, the insulin is also harming the patient, because anyone who's taking insulin also should be known about this fact. Actually, if in the type 2 diabetes, if you are taking insulin or any medication which is increasing the insulin level in the body, most of the 90% of the tablets we are taking also by increasing the insulin level, that will definitely increase the chance of cancer development. And that is, we can also see that most of the patients who develop cancer will be diabetic for a long time. And she is also diabetic for a long time, for the last 15 years. And after we have done she has actually, in the cancer center, we have solely this CT scan and all. But before this established cancers, we do a PET scan also to see the staging also. And in this actually, I think many of the cancer centers, after the surgery only, they go for the PET scan. But we are asking for a PET scan if that is a biopsy is proved cancer, to see whether any distant metastasis. If the distant metastasis is there, we should be, the local removal also may not be that helpful also. Anyway, this lady, when we took the PET scan, it was stage 4. She is having secondaries in the lungs and also in the parotid gland also. Not on the parotid tumor, but in the other thing. So, this after starting the treatment, actually we are giving a low calorie, that is cutting the glucose. Glucose actually is the main source of growth for the cancer cells. So in this clinically supported lifestyle correction, which I follow, the glucose, the carbohydrate content is minimized as much as possible, and giving a nutrition, all the nutrient in the correct proportion, especially with the high omega-3 level, and trying to bring the omega-3 and 6 level in the body to the normal, and bring down if excess fat is there on the body. She is only 151 centimeters and her weight is 55.4, and she was asked to bring down her BMI to low normal, that is to around 45 to 42. 42 is the lower normal. So bring down her weight to that. So anyway, with after starting treatment, within a month she was able to bring down her HbA1c. We stopped diabetic medicine the first day itself, and without any diabetic medicine, she was able to bring down the HbA1c to 6.1 within a month, and by the second month it came down to 5.4 and then 5.1, and her weight also reduced to within a month it has come down to 58, almost 6 kg, 58.7, and then within 3 months she was able to reach the 51 kg. So the fat level, actually she has to come down furthermore, or around 42, 45, 42 will be ideal for her. So the next PET scan also done. Then there's no, every month we'll be following it with the ultrasound scan. There is no growth on the tumor. She's hypertension, diabetes and cholesterol, everything is gone, and no medication. And she's had some pain, arthritis pain and sort of things is also gone, and she's very positively responding. And by the 6th month again, second PET scan showed a reduction in the glucose uptake, and she's almost going to be 1 year, and she's very healthy, no diabetes, no hypertension, everything is reversed and managing very well. And she was, the only thing she was asked to keep her HbA1c around 5, preferably below 5, and keep the weight to low BMI. That is, and avoid this all the color and preservatives, and also low carb diet. We'll discuss one more case. This is a young lady. It's also a stage 4 breast cancer. Young lady, 45 years, 156 centimeter height and 70 kg weight. She was initially 78 kg, and after this medication, and she has undergone so much of treatment. After that it came down to 70. She was 10 years back she had thyroid tumor, and the thyroid, actually it was not cancer, it was thyroid swelling also, it was removed, and taking thyroxine, and diagnosed breast cancer in 2020. And she was, it was actually, initially it was a lumpectomy, the lump alone was removed, and the radiation chemotherapy was given. But the same year itself she developed again tumor, and lymph node metastasis also noticed, and she had a radical mastectomy was done. And it was again chemotherapy, and again repeated chemotherapy, and again radiation has given. Then that again in the 2021, that is all happened, the 2 surgeries she had undergone, and this in the 2020, and 2021 she got a swelling on the head, that is actually in the skin, a scalp, there was a tumor, and it also excised and shown it was a cancer. Again repeat chemotherapy and radiation, the part was done. But again in 2022 she got a lung secondary, and a part of the lung, right lobe of the right lung is removed. Lobectomy was done. And again chemotherapy, a different course of chemotherapy was advised. The other not responding. The young lady, you should understand that her first older children is only the 12th class, and the younger one is in the, she has 4 or 5 children. Actually, the youngest is in the LKG or UKG. So you can understand the difficulties. And this finally the chemotherapy also cannot be given, because the no blood vein is available for so much of chemotherapy. Different courses is given, not able to get vein, and finally she was given a central venous catheter into the heart itself and tried to, but again phlebitis has occurred, and finally the cancer center said no more treatment. In that stage actually she was coming to me, and for her also he had an investigation. She had already PET scan and secondaries and everything is there, so we didn't do a repeat PET scan or anything, but the ultrasound scan showed there is fatty liver, and also blood investigations also showed that she has a NASH is there. This maybe because of so much of chemotherapy, and also she is obese. And she was not diagnosed before with the diabetes, but she is diabetic also, HbA1c 7.5. And she's on the inflammatory markers are all high and all. I'm not going into the detail. Anyway, within a month itself, she was able to come down without any medication. In our treatment, we don't give any medication, but the reversing diabetes, that is the most important thing. And her HbA1c has come down to 5.2. We are always asking to keep the HbA1c. Initially within a week it came down to 6.7, 6.4 and 6 and then 5.2. And she was able to bring down her weight also to 58 kg, from 70 to 58 kg within 3 months. And she is perfect. Actually, she was telling that from 2020 onwards, she was not always in the hospital throughout the time. And having 4 children and always in the hospital was the norm. But now after coming here, she was not gone to any hospital visit, only for this. After joining for this treatment, she has never gone to visit this oncology unit or anything. And she was very comfortable. She had so much of discomfort, discomforts were there after back pain, body pain, and so many discomforts. Everything was so gone, and she was able to manage her children and look after the children, everything perfectly well. And she was advised to bring down her weight to 45 to 50 will be ideal for her. And her fat level was so high, initially around 40%, it is 39.3, and it came down to 36.8 within 3 months. But she has to work out further and maintain her health and bring down her weight and maintain her HbA1c below 5 preferably, at least below 5.5. We will discuss one more patient. This is another breast cancer. Then stage 2 breast cancer. This is also an young lady, 42 years only, and height 147 and weight to 51.4, not much overweight. And she was okay throughout till the diagnosis actually, and the 1 month back actually she noticed swelling. And first they had gone to the doctor and this mammography and all done, and there was suspicion, and biopsy was done, and it was positive. And when the biopsy positive itself, she came to me for the lifestyle correction, and immediately they started the correction, because it will usually this FNAC positive only, so it will take that lumpectomy or this final diagnosis for the chemotherapy, radiation or mammography. It will take at least a month. So this patient is very wise, and the husband also is very cooperative, and they came for the lifestyle correction immediately itself. And we have started with the correction, and she was also advised we'll all give a low carbohydrate diet. Her blood test also showed many deficiencies in the vitamin D3, B12, and the inflammatory markers, WBCs and ESR was high, and also some toxins in the toxin. We assess the toxin level also, especially heavy metals. Tin level was high. So it is basically we are trying to detoxify this excess fat, and anything in the body, excess toxins in the body has to be removed, and ensuring the optimal nutrition and minimizing the carbohydrate, especially which can be converted. The fiber should be there, but the thing which is converted into glucose should be reduced. So in that diet actually, meantime they were following with the oncology department also. The private hospital here actually immediate surgery will be done. They wanted to go into the because their financial problem was also there, especially if you are not having any financial problem. We'll approach the private hospital, and the next day itself you can process everything fast and do the surgery and chemotherapy, radiation and everything. And her doctors also said they consulted different hospitals, private and the government. And even in the government hospitals also there is payment, and if it is insurance is not there, and so much difficulties, because according to the insurance only all the treatment in part of the country, the insurance, if at all there is also, it is everything, all sort of medications will not be covering into that. So anyway, this patient is started the lifestyle correction immediately. Usually within a month or two, that will be increasing the size. This patient actually, when she is coming to visit me, she was not able to talk also, because she was so depressed, and her husband is actually, she was keeping quiet or everything, because her child is only 6 years in the 6 years or 5 years only. So she was so devastated of the diagnosis. Anyway, she was started with that, and finally we are asked. They had undergone so many MRIs and CT scan, everything, but the hospitals, they're not asking for a PET scan. I don't know why they are not asking for. Even the suspected swellings in the axilla also is there. And she was without the PET scan itself, they asked for the radical mastectomy and chemotherapy and radiation. Anyway, we did a PET scan, and it showed that it is only stage 2 cancer. And she came to me in November, and she got final appointment for the surgery by January only, middle of January. So before that, immediately just before the surgery, we did the PET scan. So after seeing the PET scan result, the doctors also, before that, a radical mastectomy, but now they are also accepted for this lumpectomy and the sampling of the lymph nodes only, alone, the surgery. So the extent of surgery is reduced. By the time actually the tumor size was also reduced. We are following it with the ultrasound scan also. In that also, tumor size was reducing, and lymph node size also reducing. Even with the palpation, we can see the size is reducing. Only thing, it is hardening. That is, I have noticed that usually after when we start the lifestyle correction, the tumor will start reducing in the size, but it will become harder. So it is making a calcification is forming around the tumor. That is actually maybe protective calcification is coming. In the ultrasound scan also, you can see the calcification of the tumor. And the surgery was actually, she faced the surgery very comfortably, and by the time she was emotionally and also very stable, and only within 1 or 2 days discharged, and she started her exercises and all within 2 weeks after the surgery itself. And now what is actually the oncology department and advised her, if she wants, she can. It's ideal. That is advice for them by them is go for radiation and chemotherapy to see if there is anything else. But the patient has decided, and the family has decided, not going for chemo and radiation. Continue with this, and I have advised them to do one more PET scan after 3 months to see everything is clear. Then she has advised, she's only 147 centimeters height, and she has bring down her weight. She has before the surgery itself, she has bring down to 45, and bring down another 5 kg, 40 kg, and keep all the things which is this color and preservatives, and we look into the food which is reacting for her, and she's allergic to some tomatoes, lady's finger, and so many items. Next case also is breast cancer, but in the stage 1. And it's a 72-year-old lady, 145 centimeters height and 53.2 weight. And she was taking medication for hypertension for the last 20 years. And having so many, I'm not going into the symptoms, but now her major problem is she's undergoing a radical mastectomy 3 months back. And there is because, and radiation was given, but no chemotherapy. But the problem is now she's not able to get proper sleep, neuropathic pain. She's something sort of neuropathic pain on the right side, right upper arm. So, and also not able to sleep, and varicose vein problem is also there. And maybe because of that, she's having leg pain and discomforts. Now she is on hormone therapy, letrozole, and she's having hot flushes also. Maybe because of the symptoms of the side effects of the letrozole also her discomfort. And with the clinically supported lifestyle correction, after she's joined, within a month, within 1 or 2 weeks itself, she has symptoms that the pain of the hand pain and all is reduced. Even she has edematous, the hand edema also is reduced. And special sort of exercise and also food to prepare, because the immediately after surgery, so we have to, that repair of that area has to take place. The optimal nutrition and the correct exercises actually given this sleep problems was corrected, and the pain and discomforts are reduced also. And within a month itself, she was able to bring down her weight to 4 kg, and it was 53, it was come down to 49. And her BP medicine was actually, when she was coming, even with the medication, her BP was 180/100, and by the 30th day, when she by the 30th day, her BP has come down to 130/90 without medication. So that is the difference. Actually, then if she, the problem is with maybe now, but she's not fully comfortable, and maybe because the tiredness is there. Letrozole may be the thing which is producing a problem, and because I'll explain it about in the next case. I'll tell you about the tamoxifen and the letrozole, how it can be creating problem. Next, we will discuss with the problems with this hormone therapy. Actually, I'll give a few examples of long-term hormone therapy. This is a breast cancer patient. It was diagnosed in the stage 1, and she's a 33-year-old lady, and actually diagnosed while she was 31 year old, and 158 centimeter height and 50 kilo. It's not overweight also. And she was had in 2021 she was diagnosed with breast cancer, and initially a lumpectomy was done, then a repeat border excision was done after the lumpectomy surgery, then chemotherapy and radiation was done. And the thing she has noticed that she developed thyroid, Hashimoto thyroiditis after 1 year. So actually she came to treatment for this, the Hashimoto thyroiditis, and her TPO level, that is autoimmune antibody level, was so high, and she was pre-diabetic also. That was not diagnosed in the initial stage. So after starting treatment, actually she was positive for arsenic, and tin also was high for her. This toxic element also is high, and she was allergic to few food items, regular food items like milk items, groundnut, etc. So she was advised to avoid these items which is reacting for her body, and also do regular exercises, and because she is not having a active cancer, so low calorie diet is not this avoiding carbohydrate is not that significant for her. Only for when the active growth is there, totally avoiding the glucose forming or carbohydrate diet, for her it is not. There's no active cancer is not there. But she was on thyroxine also. We are able to bring down take out the thyroxine within a month itself, but her this TPO level was continuing high, and so she was family was given advice on trying to reduce, or at least for a short time, to see whether this is corrected when the tamoxifen is taken stopped. So because the oncologist has given it for prevention of the recurrence, it's an anti-estrogen. This tamoxifen is anti-estrogen that is actually blocking the estrogen receptors. And so this patient is given, this might be the option. The family has given the advice, and they have decided to taper off the medication and see what is the result. And after stopping the tamoxifen, that TPO level has started coming down, and with the diet itself, the insulin level has come down, and this was to come down to 690, then 578. Within 3 months, it has come down. That is, then it was an option for the patient to whether this continue with or without going. If they are able to, basically the reason for this cancer itself, this toxin inside their body, and avoiding that and continuing with the preferably this tamoxifen also can give this autoimmune disease and problems. Next patient also is stage 2 cancer patient. She was diagnosed with the cancer breast in 2021 actually, 2020, and breast mastectomy done, and chemo, actually it's a reconstructive mastectomy, and mastectomy plus reconstructive surgery was done, and chemotherapy and radiation, and now she is on prolonged hormone therapy. The prolonged hormone therapy, actually she was having this liver problem. For her, the liver problem, she's come to me, fatty liver, and also SGPT and SGOT is very high, 176 and 136. And when we looked into, she's having thyroid problem also started. It was not diagnosed, and AMA also positive, 186, and amylase and lipase, chronic pancreatitis also is there. And that is actually, she was, because of this, she was taking this tamoxifen and also this GnRH agonist goserelin injection every month. And to combat with the side effects of goserelin, so this zoldronic acid also is taken. That is actually, it will long term taking this GnRH agonist, that is actually blocking the ovarian function or the ovarian hormone production actually. And also everything is this, all the treatment is focused on her this estrogen, blocking the estrogen, that's a feminine hormone. So because of that, she was, one is her major problem was she's feeling suicidal tendencies and very depressed and very dull. So that was her stage. And then our way of this thing, we have suggested her to stop this goserelin, because she has taken it for a long time, almost 2.5 years she has taken continuously. That itself will reduce the bone mineral density and chance of fractures will be there. And the chronic pancreatitis and thyroiditis and hepatitis. So 3 problems to prevent the cancer, this breast cancer. We are going into more deeper problems. She can get, if the thyroiditis is there, thyroid cancer or any other cancers, or the liver cancer, or this pancreas cancer, because there is chronic, these things are there. She is also able to come out after this stopping, and this goserelin itself, within a month she was on tamoxifen, gradually tapered off, and she was able to, is much comfortable. That is the thing. And she are also asked to reduce her weight also. Excess fat is also there, around 30.4% of fat is there, and she has to reduce that also. She has 163 centimeters and 61 kg, and she was advised to reduce the weight to 50 kg. Now we have seen patients at different stages of cancer before starting treatment and after a few years, the complications. See, basically from this we should understand that there is a very important role for the lifestyle correction in the breast cancer. So even if you are going for surgery and chemotherapy, radiation also, to prevent recurrence also, it is important. Next is, if you are not willing for, if you have found that it is in the stage 4 and you are not willing for the surgery, if you are not want to go for the conventional surgeries and difficulties of chemotherapy and all, then also there is an option for you, and you can lead a comfortable and quality life with the lifestyle management itself. In short, 90% of breast cancers are caused by lifestyle related issues. Only 10% have hereditary component. Even in those who have the gene mutation that increase the risk of cancer, by identifying and correcting lifestyle lacunae, it is possible to prevent and delay cancer recurrence to a great extent. Second, as cancer is a lifestyle related disease, those suffering from obesity, PCOD, infertility, diabetes, autoimmune diseases like thyroiditis, etc., have a great risk of developing breast cancer. The easier way to prevent cancer is to identify and correct the lifestyle lacunae that actually cause the development of these lifestyle diseases. Third, lack of or excess of nutrition, toxin exposure, and hormone imbalance cause inflammation and subsequent DNA damage, which affect the genetic structure of breast cells, which leads to breast cancer. Instead of waiting for cancer to come, now it is possible to prevent cancer risk by monitoring, controlling, and reversing inflammatory markers like CRP, ESR, blood sugar, high cholesterol, high triglycerides, etc., by correcting lifestyle to prevent cancer by controlling inflammation. Fourth, cancer does not come from a lack of medications, radiation, or surgery. For this very reason, medication, radiation, or surgery may not help in full recovery or prevention of recurrence. Along with these treatments, it is essential to identify and correct the lacunae in lifestyle and could be the basis of the cancer. Fifth, today there are many types of medications, procedures, surgical interventions, some economical, others extremely expensive, and some are very complex procedures. In this situation, it is very important that a very careful evaluation of the limitations of the treatment, the possible outcome, the side effect, the related costs, both financial and emotional, especially as many cancer treatments create great stress on patients and caregivers. Sixth, it can be said that cancer cells are formed on a daily basis in our bodies. It is because the immune system is able to identify them and destroy them. Cancer does not develop in everyone. When the toxic load in our body grows, the workload of the body's immune system increases. Stress and medication can weaken the immune system. The lack of balanced nutrition can prevent the creation of the immune system fighters and ornaments in the form of white blood cells, antibodies, etc. It allows the cancer cells to survive and rapidly grow and spread. Seventh, glucose is preferred fuel source for cancer cells to grow and multiply. The first step if cancer is suspected is to avoid sugar and carbohydrates. The next step is to strengthen and support the body's immune system. However, nowadays, most cancer treatments do not strengthen the body's immune system. On the contrary, they focus on treating cancer by destroying the immune system. Eighth, the very beginning of the body's immune activity starts inside the marrow within the bones. This means that if the immune system has to be activated, it has to begin by activating the bones and the bone marrow within. To activate the bones, it is essential to activate the linked muscles. To activate the muscle, it is essential to do physical activity. This means that only by physical activity can the muscles activate the bones and the bone marrow within to strengthen the immune system. Ninth, it is when appropriate, physical activity helps activate all 650 muscles and 230 bones in human body, and when all 57 nutrients essential for the human body are available in the right quantities and proportions, and the toxic content in the body is reduced, that the immune system can work optimally and destroy cancer cells and create the circumstances for the body to return to the healthy state. 10th, it is best to understand that the real doctor, or more correctly, the healer, is the body's immune system. The goal of treatment should be to strengthen this doctor, healer, and to provide the necessary extension of time required for this strengthening. Before starting any treatment, it is essential to understand if the treatment will strengthen and support the immune system, or whether it will increase the workload of the immune system, or whether it will weaken and block the immune system. It is necessary to avoid treatment that destroy the immune system, which is the body's real doctor, healer. As the approach mentioned here is different from what we see commonly, it may be difficult for some viewers to follow this. Today, with some application of the mind and an understanding of the use of PET scan for diagnosing cancer and to evaluate its stages, it will be possible to understand the science behind this approach. Understanding how poor decision making can make the patient and close ones live even more distressing due to the abnormal fear of cancer, which leads to the increased use of risky surgical procedures and medication with all the side effects and associated suffering, will hopefully help in taking more logical, practical and humane decisions with the patient's best interest in mind. Next, let us understand what is clinically supported and supervised lifestyle correction. In this, first step is to understand your body's parameters by assessing body composition, the lean mass fat mass ratio, body age, fat status, etc. Second step is to evaluate the current status of your organs like heart, blood vessels, liver, kidney, pancreas, hormones, immune system, toxin level, nutritional status, etc. And also to find out the most suitable food for your body and what to avoid. Third step is to identify what lifestyle modulations can help achieve reversal of disease process, attain desired body composition and normalize blood parameters. Based on the patient parameters, effort is directed to provide optimal nutrition, physical activity and reduce toxin level. The focus is to create an enabling environment to balance the metabolic activities at cellular level. In most patients, even those on medication for many years or advise surgery for lifestyle diseases like diabetes, hypertension, heart disease, arthritis, autoimmune diseases, cancer, allergies, etc., can prevent progression of diseases, to some extent reverse the damage and come out of most of the medications within a month and avoid surgeries provided the patient is able to correct lifestyle before the organs are irreversibly damaged. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation and all cells by planned exercise. Third, minimizing the toxin entering the body through food, water, air and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. It is good to understand that neither medication nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once the medication is started, very often both the disease and the medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson. Started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service, later resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tayavara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us human but to all life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medication. To protect our children, grandchildren and the coming generations from the ill effects of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends, and colleagues who are on chronic medication or planning surgery for lifestyle disease. The last few decades of modern medical management clearly shows that medication and surgery cannot cure most lifestyle diseases. Reliable and sustainable solution lies in the lifestyle moderation. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with clinically supported lifestyle modulation, etc., you may visit our healthcare channel. Thank you.